around there where that.
Kasi Imran Boozer, 7 years old, is one of these sickle cell children struggling for his life after getting repeated strokes, which medical specialists have termed as big strokes in little children.
But seeing a child with stroke is not that common, and it's only sickle cell disease that brings about this condition. Stroke is usually common in children between the ages of 2 to 10 years, but there's a peak range of 2 to 5 years.
Imran was diagnosed with sickle cell disease at 8 months old, and since then he has been in and out of hospital. Although his earlier years were not as bad, Imran started getting serious complications early last year. This included severe joint pains and strokes. In a space of just 1 year, Imran has suffered 4 strokes. Imran's parents say the 4th stroke was so severe to the extent that it affected his hands, which he does not use anymore, and caused memory loss. He now feeds through tubes.
He eats through this tube. I think some of you have seen me feeding him through this tube. Now, a person who loved food, a person who could swallow very well, is only feeding through this. A 7-year-old feeding on milk, feeding on yogurt, feeding on blended things.
Now, a bone marrow transplant, I encourage many of you to go and read about it after here. It's a very, very expensive endeavor. Right now, it's the only remedy that is offered to end this pain that our children go through.
Dr. Deogratius Munube, a pediatrician with Sickle Cell Clinic, Mulago Hospital, disclosed that 100 children visit this clinic on a daily basis for care. 10 to 15 are admitted per day, and 6.8% of children with sickle cell get strokes.
It's sad for me to say that we have only one sickle cell clinic, which is located in Mulago Hospital. However, on the positive note, there are plans to have more sickle cell clinics across the country.
Imran needs a bone marrow transplant, which goes for $100,000 for the operation in India. However, his family can hardly afford this expensive treatment and have embarked on a fundraising campaign using the social media dubbed Save Kasi's Life. $35,000 have so far been collected, and the final fundraising drive is set to happen this Saturday at Hotel Africana People's Space. This will also involve raising awareness about the sickle cell disease, a car wash, and free sickle cell screening. Health workers have repeatedly advised couples to test for sickle cells before having children, since it's the only way the genetic disease can be tamed.
What's the advantage with the children knowing now your child is 5 years, your child is 10 years? If your child is a carrier, then they will make a better choice when they want to have families in future. To save the nation, to save Uganda, we need to look into the genetics